Hello doctor, I am Rahmة Ahmed and I am going to speak about a chicken which is considered an ideal model for biomedical research under supervision Dr. إستفتاح محمد الكومى. Quickly, let's go know important outlines which starts by introduction, application of the chicken periclarantonic membrane in neurosurgery disease, the CAM as an effective model to study glioma and angiogenesis and anti-angiogenesis, application of the CAM in vascular disease research, the check as model for cancer biology, check models for human disease and condition which contain cranial and retinal disease, conclusion and finally references. Firstly, selection of appropriate animal model is essential to advancement of basic and clinical research. So, why chicken is being used in biomedical research? Because the chicken is currently the ideal model valuable to probe in the etiology and progression of human ovarian cancer, as well as to test chemotherapy agents and for toxicological studies because of its sensitivity and rapid response to environmental toxin and expression of external indicators such as the thickness of shell. Application of the check periclarantonic membrane in neurosurgery disease. Firstly, the check periclarantonic membrane, the abbreviation to CAM, is an extra embryonic membrane and its main function is to exchange gases and nutrients, which is supported by a dense capillary network. This figure shows the check periclarantonic membrane in biology, medicine and bioengineering. The check periclarantonic membrane, a well-established in vivo assay, the CAM model has contributed to fundamental scientific discoveries, including the link between oncogenes and the formation of cancer. Due to its extensive vascularization and its ease of use, the CAM is a widely utilized research tool, and because of its extensive vascularization and easy accessibility, morpho-functional characteristic of angiogenesis in vivo, as well as the efficacy and mechanism of action of pro and antigenic molecules have been studied using the CAM. This figure shows the general vascular system of the clarantonic membrane, which A shows the capillary pelix of CAM of 10-day-old chicken embryo, and B shows the umbilical artery and umbilical vein free-floating within the amniotic. Due to the lack of fully developed immune system in the chicken embryo, the CAM is suitable for tumor engraftment to study various aspects of the angiogenic and metastatic of human malignancy such as leukemia, glioma, prostate cancer, osteosarcoma. In addition, the CAM has been used to test the biocompatibility of organic and inorganic materials. The CAM as an effective model to study glioma angiogenesis and anti-angiogenesis. So, angiogenesis is essential in establishing a network of blood vessels need to supply oxygen and nutrients required for promoting the survival and invasiveness of glioma cell. What about glioma cell? It releases specific growth factors to activate endothelial cell growth of the host tissue in order to become highly vascularized. DMPP is abbreviation for dimethylphenylpiperazine iodide, is an anti-angiogenic in dose-dependent manner. U87 glioma cell xenograft treated with DMPP has less growth and angiogenesis compared with the untreated cell. This figure shows the DMPP treatment in breed glioma growth on the check corium planted on 8 days check CAM. IGFBB7, which is abbreviation to insulin-like growth factor binding protein 7, is a tumor suppressor gene which has been proposed to participate in sensi, apoptosis and late phase angiogenesis of tumor cell. After treatment of the CAM U87 glioma model with IGFBB7, the size of the formed vessels and the tumor were reduced by 40% compared with untreated tumors. This figure shows its structure. Martini utilized the CAM glioblastoma model to study the effect of the RTKI receptor tyrosine kinase inhibitors. RTK is abbreviation for the receptor tyrosine kinase inhibitors and genases and tumor proliferation in vivo, and observed that RTKI reduced the number of blood vessels required to tumors and inhibit tumor growth. Combined with additional in vitro experiments, they identified new receptor tyrosine kinase RTK targets of RTKI. The glioblastoma model could be used to identify potential predictive biomarkers to anti-RTK therapies and provide a basis for specific targeted therapies in the future. EBO is abbreviation to erythropoietin, is a cytokine with pleiotropic effect which exhibits a wide variety of biologic function in non-hematopoietic tissue such as angiogenesis. To determine whether EBO was stimulating angiogenesis in the glioma, treated the glioma model with an anti-EBO antibody. They observed that angiogenesis was inhibited, suggesting that EBO may play a role in glioma angiogenesis. Who inoculated the IRE1 is abbreviation to the install requiring enzyme 1 alpha dominant negative U87 cell on the cam. He observed the size of tumor was significantly smaller and the tumor angiogenesis was decreased compared with control cell. This figure shows IRE1 is a key regulatory of angiogenesis and vision in malignant glioma. Application of the CAM in the vascular disease. There is a close relationship between the abnormalities during the embryonic period and the formation of some congenital intracranial vascular anomalies such as erythrovenous malformation. The dense capillary network and the characteristic of continuous angiogenesis of the CAM provide a model for studying this vascular anomaly. For example, myomoid disease. Myomoid disease is a progressive intracranial vascular disorder, particularly affecting the circle of Wells and its arteries that result most commonly in transient ischemic attacks. This figure shows the comparison between the normal artery and myomoid disease. The chick as a model for cancer biology. The chick embryo is a model that overcome many limitations to study the biology cancer in vivo, so the avian can successfully support most cancer cell characteristics including growth, invasion and angiogenesis. Finally, chick model for human disease such as cranial and retinal disease. Firstly, cranial disease is a serious condition that can cause clothing distortion, scarring and eventually blindness, and the chick crania is well studied for study of cranial wounding, healing, ossification and refractive surgery and transplantation, particularly given the anatomical similarities with human. This figure shows the cranial disease. The cranial endothelial layer is responsible for maintaining cranial detergence and play a role in a variety of human disease. Managers demonstrated that cranial endothelial cell can be harvested and cultured from the chick embryo. Retinal disease. The chick retinas cone predominance, large eye size and similar cellular response to retinal damage as occur in human make it advantageous research model. This figure shows a retinal intravitreal injection of the ا.م.د, which abbreviation for N-methyl D-aspartate toxin, cause excitotoxic damage in the retina with neural apoptosis concentrated in the inner retina. This figure shows the ا.م.د receptor. Several human diseases have a significant component of the excitotoxic damage with elevated glutamate, including diabetic retinopathy, vascular occlusion. Conclusion: we should know the selection of the appropriate animal model is essential to the advancement of basic and clinical research, and the century of experimentation with the chicken built a foundation of knowledge that facilitate its use today for understanding human development and disease. Reference, and thank you.